Now, I have Scott Kahan, who's director of the National Center for Weight and Wellness, and we're going to talk about bending the curve. Scott, great to see you. Thanks for hanging out.
You as well.
Good to see you. Have you heard the morning program yet?
Oh yeah.
Yeah. Who
great.
frustrated you most?
All the talk about EHRs is it hits home.
Oh yeah.
They're challenging.
So EHRs are
Electronic health records. Or
electronic. Okay, that's what they are. So I got to remember the lingo that I was getting. So you live in that space and live in that world. We met a decade ago or so when I was at the Atlantic and we're doing this, and you made an interesting comment, if I can share with everybody. Hey, despite a lot of this, we're still struggling with some of the same meta issues, some of the same tectonic problems in dealing with chronic health and dealing with chronic disease, dealing with many of the issues that are out there. And I just want to start out and ask you, do you see anything on the horizon that gives you hope that the conversation will be different 10 years from now?
I mean, look, technology evolves, innovation evolves, so I do think that we'll make some more progress. We were talking specifically about moving upstream, moving more toward prevention, moving more toward proactive rather than reactive treatment and approaches in healthcare. I think we'll certainly move forward. I don't know how much we'll move forward. Certainly right now, things have been stifled.
In America's weight and wellness picture, who are the villains?
They change from month to month and year to year. Right now, the food industry is certainly the villains. It wasn't long ago before pharma were the villains, and that's certainly changed. There's a lot of challenges. Innovation with medications is going to continue to be helpful, but we live in a society that essentially drives obesity. The highest calorie, most fattening foods tend to be the cheapest foods, the most heavily marketed foods, the largest portion foods. They're marketed and engineered to be the most fun foods. That's a hard thing to counter with just willpower or with willpower and medication. That's what we've been doing so far, and we've been doing it decently well, but we're still behind the eight ball on that. And to make real long-term, society-wide progress, it's going to have to be more than a doctor-to-patient treatment. It's got to be more broader societal change.
But one of my favorite, you talk about the food industry, but one of my favorite articles ever in the Atlantic, which got the Atlantic probably a historic level of hate mail, was a cover story with a Big Mac on the cover of the Atlantic. I don't know if you remember that. And it was basically saying, hey, if we're going to achieve higher nutritional balance and realities in this country, you've got to work with the fast food industry and whatnot. And I sort of thought it was a great piece, and I remember meeting with a lot of these players. Has that social contract with them been lost, or were we deceived?
So I don't remember that article entirely, although I vaguely remember the cover.
Visually of
yeah.
It basically was saying the Big Mac is the answer. That if you can get, and everything behind that, that in fact, if you got greater embeds of nutritional information, of better standards in food. I guess I can say this, I had breakfast the other day with the CEO of Chipotle, and he's on a mission right now to raise cattle differently and basically organically without all of these antibiotics and whatnot that are constantly fed cattle. He says it's changing people's biome, microbiome and whatnot, and changing whatnot. He says we have to stop doing that. It was a very enlightened comment from the CEO of Chipotle. So do you see any progress on that, or is that something we need to still work on?
Slow progress, and I certainly don't think that there's any silver bullet here that's going to solve everything. We're not getting rid of Big Macs anytime soon. We're probably not going to be entirely re-engineering the healthfulness of Big Macs either anytime soon. But that has to be one of a range of approaches to again reorganize society a little bit here, making it just a little bit less challenging to manage weight and health and blood sugar and things like that.
So what's the answer?
Well, first of all, I don't think that there is, again, a single bullet answer. I think we have to be thinking broad. We have to be thinking across a number of areas. If you look by way of analogy at other major public health successes in the past century or two, one would be tobacco, for example. there's great medications and individual treatments, counseling for tobacco, and that has brought rates down quite a lot in the last 20 years or so. But prior to that, the rates of tobacco use came down by 95% or so. And those were driven first in the 40s and 50s by good education that helped to change the context so that people understood that smoking was really, really bad for you. And then after that, Surgeon General reports, distributing that information. After that, taxation that made it harder, especially for young kids, to be able to even start to smoke because it got more expensive. And bans of marketing in magazines, on TV, and elsewhere, and so on and so forth, bringing all of these different approaches, both top down and bottom up, and that led to the roughly 90% decrease in tobacco use over the past century and change. Same thing with infectious diseases, and we have great antibiotics, but the majority of decrease in infectious disease deaths came before penicillin and then the newer antibiotics. And they were driven by public health interventions, things like decreased overcrowding in cities, healthier water, and so forth. And so we have to be thinking that way. The medical treatments are really important, but by themselves, they're not likely going to be enough.
So obviously the big topic right now in your space on weight and wellness is the fact that there are new drugs out there. Some are FDA approved. Lilly is a major player in this, Novo Nordisk, others. There's some that are not FDA approved that are out there. I mean, I would say it's the biggest topographical shift in whatnot. You're seeing really interesting reports from places like Kroger's and Albertsons and Ralph's and others about the change in people's buying habits. Do you think this is a smart systemic shift towards health and decrease in obesity, or do you have problems with it?
I think it's an extremely important piece of the puzzle. It's not going to solve the problem by itself, but it's incredibly, incredibly valuable, and for a number of reasons. For one, lots of patients are being helped by these medications, and still many more have the opportunity to be helped. But there's also societal shifts that these are driving. So for example, the general public, which has generally been very stigmatizing and judgmental about heaviness and obesity and such, seeing how people's lives can be changed and how their behaviors can be changed, sometimes like this, upon taking a medication, helps to shift the discussion around obesity being just a bad habit to something that is metabolic, to something that is a disease, if you will, or a medical condition or the like, and that is not entirely in our own control. I think that's an incredibly important part of this. And so again, I think with any complex system, there's no single node that is gonna, cause it or solve it. But these different nodes are interacting, and I think that the advent of these newer medications and the increased use of these newer medications
is there something we can learn? I mean, I'm genuinely interested in this because it was years ago I moderated a roundtable. It's probably one of the most memorable ones I had. It was in Baton Rouge. It was sponsored by Blue Cross Blue Shield, and we had a discussion about, obesity and intergenerational obesity, morbid obesity, and how to deal with it. And it's before we were in any of the drug options we have today. I met a young woman there. It almost made me cry thinking about how she was trying to change the pathway and the stars of her family in this space. But the cards were so stacked, the ecosystem, as you described it, didn't allow any escape hatches. And so I'm interested in these new drugs. And do they give somebody an escape hatch? If you get enough people in the escape hatch, do they begin to get that society and that ecosystem to consider operating differently? Mm-hmm. And I don't know if we're far enough along for that. But when you kind of look at this has gone viral, I'm wondering whether those ecosystems can actually shift in something that's much more constructive in terms of reinforcing public health, positive public health outcomes.
Very possibly. I mean, you're right. The ability to treat obesity successfully has increased substantially. And even before these newer drugs, we could help a lot of people, but not nearly as many as we can now. And we do see lots of lives changed. And I do think that there's all sorts of tentacles in society that can emanate from that. And we're still, pretty early here. And so we'll see how that plays out.
I'm going to bring up Derek Assay in a moment, from Eli Lilly, and we're going to have a discussion. and I'm going to involve some of you in that conversation as well. But I'm interested in your advice, since this is your, your avocation. You've been swimming in this space for a long time. Are there things that companies like Lilly can do to become more effective in that new social sculpting beyond the drug itself?
Yeah, and I think they're doing it from what I've talked to them about.
What is it?
For one, they're engaging in research that goes beyond just bringing new molecules to the table, but rather how medication treatment can sit within a broader societal approach, how to address a lot of the stigma and misperceptions around obesity and diabetes treatment and so forth. I think that's a really important part. They're here at events like this, driving forward discussion like this.
This is the best event, though.
It is the best event, just like the last one we were at some time ago. We're
going to do this annually, by the way. You can come back.
I hope so.
Yeah,
I hope so. I think that at least certainly the big companies, they're aiming at more than just development of new medications, and I think that that's going to be an important partnership going forward.
Well, I want to thank you for joining us. Scott Kahan, Director of the National Center for Weight and Wellness, thanks for bringing your experiences to this important topic today.
Thank you.
Scott, thank you so much.